If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, do you have a permanent solution for controlling diabetes type 2? Answer by Sosifina Tanyafai. Type 2 diabetes, in a lot of cases, can be reversed. Is reversal a cure? That is the debate. Unfortunately, not all type 2 diabetics can reverse their condition. Like type 1 diabetics, some have very little or no control over their outcome. Persistent diet, exercise and lifestyle changes can lower A1Cs to a level deemed non-diabetic. It must be noted that the lifestyle changes need to be maintained, otherwise the diabetes simply returns. So in short, type 2 diabetes can sometimes be reversed. But in my opinion, it can only be cured providing that the cure is a change that you implement and keep up with the rest of your life. In my opinion though, a cure would mean that you could live your life normally without making adjustments to your lifestyle. Eat what and when you want and have a non-diabetic HbA1c, all without diet, exercise and carbohydrate intake limitations. First steps include simple changes in your lifestyle. 1. Typically changes in your diet. 2. The adoption of a more physically active lifestyle. 3. Medications if prescribed. Because your healthcare provider prescribes oral hypoglycemic medications at diagnosis, it does not mean you will need to stay on them. They may help with reducing your blood sugar to an acceptable level in the early stages. They are frequently used in the early days post-diagnosis, in tandem with a healthy eating plan and exercise. Once you start to change your eating plan and lose weight, your blood sugar levels will start to drop naturally and successfully control your type 2 diabetes. Answer by Christopher Payne. Disclaimer first, this is going to be quite generalized and may not apply to everybody with type 2 diabetes. Please read on with a large pinch of salt. Type 2 diabetics are normal people, but for whatever reason, your insulin is not doing its job properly. That's the very basic version anyway. For a type 2 diabetic to control their condition, they have to do 2 things. 1. Stop placing such a strain on the pancreas. 2. Make efficient use of the insulin that their pancreas is producing. What I am saying is that if you eat less carbs, it won't matter that you are type 2 or not. You have enough insulin to do the job. Part 2 says that if you exercise, you use insulin more efficiently and thus making it easier to fulfill point 1. The 2 handy hands. Muscle uses glucose, even when not being used, and body fat makes insulin less efficient. Shocker, right? Eat less carbs and exercise more. But think of type 2 diabetes as a vicious circle. In order to escape, it has to be broken. The way that I like to view my condition, type 1 diabetes, is to compare it to something much more common. Something shared by every human on the planet. This terrible affliction called thirstiness. There is no cure. The only solution is to drink water every day. Do we see drinking water as optional? No. So why should diabetics see exercise and living healthfully as optional? Answer by Abhishek Gupta. Research shows that you can greatly reduce the risk of developing type 2 diabetes and prediabetes when a person has type 2 diabetes, it can happen that the body cells have difficulty using insulin or that the body is not producing enough insulin. As a result, glucose can accumulate in the blood to reach harmful levels. Type 2 diabetes is more common in people of middle age or older, but young people can also develop the disease. But now, type 2 diabetes is becoming more common in young people, along with increasingly high rates of childhood obesity. There is a good website with some informative blogs on diabetes. You can check it here. Latest healthcare and news. Discuss. Med.